we say. At Jefferson we are achieving, advancing each day. We made it to Magnet. Whoa, the journey was worth it. Oh yeah, we're working together. Whoa, and don't it feel great? Hey, it's all out now. From ER to OR, a new day is dawning, it's true. As part of the Jefferson team, we know just what to do. We're reaching our goals, now there's nothing to stand in our way. Together we share all the pride and success in our day. We made it to Magnet. Whoa, the journey was worth it. Oh yeah, we're working together. Whoa, and don't it feel great? Hey, it's all out now. We made it to Magnet. Whoa, the journey was worth it. Oh yeah, we're working together. Whoa, and don't it feel great? Hey, it's all out now. At Jefferson Hospital, we aim to stay at the top. Our doctors and nurses are driven,
They just will not stop. Quality care
for
for
our patients is not just what we say. At Jefferson, we are achieving, advancing each day. We made it to Magnet. Whoa, the journey was worth it. Oh yeah, we're working together. Whoa, and don't it feel great? Hey, it's all out now.
Hi, my name's Lakin,
And my name is Melody.
And I'm Jerry.
and we're going to be discussing the history of the magnet hospitals.
We'll also be discussing the 14 forces of magnetism.
And we'll also talk about the pros, cons, and the benefits of magnet hospitals.
Okay. You may wonder what a magnet hospital is, and we're going to tell you today. We're going to be doing our presentation over voice, and I will be discussing what a magnet hospital is.
A magnet hospital is an award given by the American Nursing Credentialing Center, also known as the ANCC. This award is given to recognize healthcare organizations that provide nursing excellence. This is distinguished by the 14 forces of magnetism. Hospitals are striving for magnet hospitals because it has been brought to the public's attention that magnet hospitals are the place to receive patient care. To be a magnet hospital means that the hospital serves excellence. However, some would disagree. During this presentation, we will deliver all pros and cons to accepting the Magnet Hospital Award and then show two brief videos, one positive and one negative. The Magnet Hospital was first identified through research done in 1983, where the ANCC developed a study of 163 hospitals. This is when ANCC created the force of magnetism. In 1997, the program name changed to the Magnet Nursing Services Recognition Program. In 1998, Magnet Nursing Services Recognition Program was expanded to recognize nursing excellence in long-term care facilities. In 2002, the program name officially changed to the Magnet Hospital Recognition Program. And in 2008, they developed the 5 key components, which we will discuss further on in the presentation.
The forces of magnetism are a very important part of the Magnet Hospital Status Program. We're going to discuss each one of the 14 forces of magnetism. I'll start with the first few, and then I'll have some help from Jerry on the last ones.
According to the American Nursing Credentialing Center, the original magnet research study from 1983 first identified 14 characteristics that differentiated organizations that were best able to recruit and retain nurses during the nursing shortages of the 1970s and 1980s. These characteristics became the ANCC forces of magnetism that provide the conceptual framework for the magnet appraisal process. Described as the heart of the magnet recognition program, the forces of magnetism may be thought of as attributes or outcomes that exemplify excellence in nursing. The full expression of the current 14 forces of magnetism is the requirement for designation as a magnet facility and embodies a professional environment guided by a strong and visionary nursing leader who advocates and supports excellence in nursing practice. Force 1. Quality of nursing leadership. Knowledgeable, strong, risk-taking nurse leaders follow a well-articulated, strategic, and visionary philosophy in the day-to-day operations of the nursing services. Nursing leaders at all levels of the organization convey a strong sense of advocacy and support for the staff and for the patient. Force 2. Organizational structure. Organizational structures are generally flat rather than tall, and decentralized decision-making prevails. The organizational structure is dynamic and responsive to change. Strong nursing representation is evident in the organizational committee structure. Executive-level nursing leaders serve at the executive level of the organization. The chief nursing officer typically reports directly to the chief executive officer. The organization has a functioning and productive system of shared decision-making. Force 3. Management style. Healthcare organization and nursing leaders create an environment supporting participation. Feedback is encouraged and valued and is incorporated from the staff at all levels of the organization. Nurses serving in leadership positions are visible, accessible, and committed to communicating effectively with staff. Force 4. Personnel policies and programs. Salaries and benefits are competitive. Creative and flexible staffing models that support a safe and healthy work environment are used. Personnel policies are created with direct care nurse involvement. Significant opportunities for professional growth exist in administrative and clinical tracks. Personnel policies and programs support professional nursing practice, work-life balance, and the delivery of quality care. Force 5. Professional models of care. There are models of care that give nurses the responsibility and authority for the provision of direct patient care. Nurses are accountable for their own practice as well as the coordination of care. The models of care, for example, primary nursing, case management, family-centered, district, and holistic, provide for the continuity of care across the continuum. The models take into consideration patients' unique needs and provide skilled nurses and adequate resources to accomplish desired outcomes. Force 6. Quality of care. Quality is the systematic driving force for nursing and the organization. Nurses serving in leadership positions are responsible for providing an environment that positively influences patient outcomes. There is a pervasive perception among nurses that they provide high-quality care to patients.
My name is Jerry, and I'm going to continue discussing the forces of magnetism. Force number 7 is quality improvement. The organization has structures and processes for the measurement of quality and programs for improving the quality of care and services within the organization. Force number 8, consultation and resources. The healthcare organization provides adequate resources, support, and opportunities for the utilization of experts, particularly advanced practice nurses. In addition, the organization promotes involvement of nurses in professional organizations and among peers in the community. Force number 9, autonomy. Autonomous nursing care is the ability of a nurse to assess and provide nursing actions as appropriate for patient care based on competence, professional expertise, and knowledge. The nurse is expected to practice autonomously, consistent with professional standards. Independent judgment is expected to be exercised within the context of interdisciplinary and multidisciplinary approaches to patient, resident, and client care. Force number 10, community and healthcare organization. Relationships are established within and among all types of healthcare organizations and other community organizations to develop strong partnerships that support improved client outcomes and the health of the communities they serve. Force 11, nurses as teachers. Professional nurses are involved in educational activities within the organization and community. Students from a variety of academic programs are welcomed and supported in the organization. Contractual arrangements are mutually beneficial. There is a development and mentoring program for all staff preceptors, for all levels of students, including students, new graduates, experienced nurses, etc. Staff in all positions serve as faculty and preceptors for students from a variety of academic programs. There is a patient education program that meets the diverse needs of patients in all of the care settings of the organization. Force number 12, image of nursing. The services provided by nurses are characterized as essential by other members of the healthcare team. Nurses are viewed as integral to the healthcare organization's ability to provide patient care. Nursing effectively influences system-wide processes. Force 13, interdisciplinary relationships. Collaborative working relationships within and among the disciplines are valued. Mutual respect is based on the premise that all members of the healthcare team make essential and meaningful contributions in the achievement of clinical outcomes. Conflict management strategies are in place and are used effectively when indicated. Force 14, professional development. The healthcare organization values and supports the personal and professional growth and development of staff. In addition to quality orientation and in-service education addressed earlier in Force 11, nurses as teachers, emphasis is placed on career development services. Programs that promote formal education, professional certification, and career development are evident. Competency-based clinical and leadership management development is promoted, and adequate human and physical resources for all professional development programs are provided.
Okay, I'm going to be talking about the 5 key concepts of magnet programs, and the first one is transformational leadership, structural empowerment, exemplary profession practice, new knowledge, innovations, and improvements, and empirical outcomes.